Hello, everyone. This is Tom Fox, and I'd like to welcome you to a special 5-part series on monitoring in healthcare, adding value to your ethics and compliance program through the use of an independent integrity monitor. This special 5-part series is sponsored by Affiliated Monitors. Founded in 2004, Affiliated Monitors provides professional, independent integrity monitoring and ethics and compliance assessments nationally and internationally across almost all industries. With its knowledge of effective ethics and compliance programs and culture, Affiliated Monitors is respected for its work as the corporate monitor on matters ranging from multinational corporations to small and mid-sized companies and even individuals. Having served in over 700 monitorships, no one has more experience as an independent monitor than the team at Affiliated Monitors. For more information on how an independent monitor can help improve your company's ethics and compliance program, visit our sponsor, Affiliated Monitors, at their website, www.affiliatedmonitors.com. On this exploration, I am joined by two persons from Affiliated Monitors. Jesse Kaplan, he's the Managing Director of Corporate Oversight, and Catherine Keys, she's the Vice President of Operations. This 5-part series will include, in Episode 1, an introduction to the use and value of an independent integrity monitor in the healthcare sector. In Episode 2, how proactive assessments of healthcare ethics and compliance programs and cultures work. In Episode 3, independent integrity monitoring for healthcare professionals in licensing and disciplinary procedures. In Episode 4, we'll take a look at independent integrity monitoring of conditions required of healthcare organizations or systems in non-disciplinary administrative proceedings. And we'll conclude in Episode 5 with using independent integrity assessments and monitoring to limit the adverse consequences of compliance violations. Whether you're in the healthcare industry or in another industry, this will be a fascinating exploration on how you can utilize the independent integrity monitoring concept in a wide variety of ways. I know you will find it interesting. I know you will find it useful. Hello, everyone. This is Tom Fox, and we are here for Episode 1 of our 5-episode series, Monitoring in Healthcare, Adding Value to Your Ethics and Compliance Program. In today's episode, we introduce our introduction to the use and value of an independent integrity monitoring in the healthcare sector. My guest for this episode is Jesse Kaplan. He's the Managing Director of Corporate Oversight at Affiliated Monitors. So, Jesse, first of all, let me thank you for taking the time to visit with me today.
My pleasure, Tom.
So let me just jump right into it, Jesse, and ask you, independent integrity monitoring can be particularly valuable and important in the healthcare sector, but why specifically in the healthcare sector?
Yes, Tom. And what I'd like to do is just give you kind of my perspective from my background, and then I can answer your question a little bit more directly. So I have about 30 years of experience as an attorney, and most of that time in the healthcare sector. About 20 years as a government enforcer and regulator, first with the U.S. Department of Justice, then with the Massachusetts Attorney General's Office, and then most recently as General Counsel for the Massachusetts Executive Office of Health and Human Services. But I've also been on the private side as a General Counsel of a healthcare organization. So when I look at compliance risks, compliance programs, I look at it from both the perspective of enforcer, regulator, as well as the perspective of someone who counsels healthcare organizations. So to get to your specific question, the healthcare industry, as anyone who is in the healthcare industry knows, has unique and significant elements to it, particularly on laws, regulatory oversight, that gives it a particular high risk of compliance issues, compliance violations. On the positive side, healthcare organizations also, though, have good strategies and resources available to help mitigate those risks. And we'll talk about it. But using an independent third-party compliance expert or monitoring firm can be one of those strategies, resources to help mitigate that risk. So why healthcare? Why is it particularly significant for healthcare? Well, first of all, the healthcare industry accounts for something like 20% of our economy. And of the massive amounts of money that are spent keeping Americans healthy, a very large portion and a growing portion of that money comes from the taxpayers, from federal and state programs like Medicare, Medicaid, TriCore, the VA. So whenever you have lots of money being spent in a particular industry, you've got the potential for fraud, waste, and abuse. And when you have taxpayer money involved, as we all know, you have the potential for False Claims Act or government liability. Also, the healthcare industry is highly regulated. Most, if not all, healthcare providers, whether individuals or organizations, are going to be licensed by the state, either by a board or by a state agency like the Department of Health. And some might even be licensed or certified by federal authorities. You also, unique to a large extent in the healthcare industry, healthcare organizations also have the responsibility of pushing down certain regulatory requirements down to your vendors, what are called FDRs, or first tier, downstream, and related entities. Government laws and regulations and agencies expect you to push down certain requirements to those FDRs, and then you are responsible for making sure those FDRs comply with those compliance requirements. As we all know, the healthcare industry has unique and significant protections of patient privacy and security. And also, in healthcare organizations also get enhanced scrutiny often when it comes to either strategic transactions or even investments. So, for instance, most providers in healthcare, whether it's hospitals or physicians, they operate in local markets. So when hospitals merge in a local market or acquire physician offices, those transactions are going to be highly scrutinized by state and sometimes federal regulators, antitrust or otherwise, to ensure that competition is not compromised through those transactions. And in many states, if not all, major capital improvements or expansions are going to need approval by a regulatory agency like the Department of Health through something called a certificate of need or determination of need. So when you take all those elements together, the healthcare industry is highly regulated. Lots of different laws apply, and as a result, there's great compliance risk. Having said that, there are strategies and resources available to help mitigate those risks.
So why don't you tell us about some of those strategies as focused really on the healthcare sector?
Yeah, absolutely. And I'm going to, so as I mentioned, what we're talking about here is really one of those strategies being the use of an independent third-party compliance expert. It can be termed different, using different terms, an independent compliance monitor, an IRO, for instance. And I'm going to break down into two buckets. One is using an independent compliance expert to do a proactive assessment of a healthcare organization's compliance and ethics program and culture. And the other is when and if a healthcare organization has a compliance issue, and particularly where a government agency might now be involved in investigating or enforcing that compliance issue, the use of an independent integrity monitor to demonstrate to the government that the organization has identified and remediated its issues, compliance issues, and will be having an independent monitor to make sure that those remedial measures are being implemented and will continue for a period of time to make the government feel comfortable and allowing that healthcare organization to continue to operate and to continue to participate, for instance, in a government program. So first with the proactive, and I'm going to do this kind of a high level because I think we're going to go into proactive assessments in a little more depth in another episode. But at a high level, a healthcare organization can get a lot of value by bringing an independent compliance expert to come in and assess not just whether the organization has a compliance program that appears to meet all the elements, for instance, the 7 elements of an effective compliance program, but can come in and actually assess whether that program truly is effective, assess the culture, the ethical culture of the organization, identify gaps, make recommendations to remediate those gaps, and provide the organization with a particular level of comfort that the structure and of the program is truly now effective, and that the culture of the organization is such that compliance has been embraced by the workforce throughout the organization from the top to the bottom. The second, as I mentioned, is when there's actually an issue and you've got the government involved in looking at a compliance issue with this healthcare organization. Bringing an independent compliance monitor can help demonstrate to the government that this organization, on the violations, for instance, say compliance violation of this organization, is not indicative of systematic problems with the compliance program or the ethical culture of the company. Can help demonstrate, no, this was a problem that was truly a one-off, that the problems have been remediated, and that through monitoring, that the government can feel comfortable that this organization is going to be a compliant and quality organization going forward, and therefore could help this organization avoid more severe sanctions, which could even include avoiding, for instance, having a license suspended or being excluded from a government healthcare program.
So let me pick up on one of the themes I've already heard from you, Jesse, and that's really, it seems to be there's a couple of different functions a independent monitor can bring. One is helping a company, or rather working with the government to ensure compliance with regulation, with a oversight requirement, corporate integrity agreement, a variety of things. But it's also to bring a specific healthcare compliance expertise to a hospital, to a healthcare provider, to a service provider who may need that specific expertise to help them either meet regulations or even increase their service capacity. Did I understand that correctly?
Yes. I mean, I think an independent compliance monitor typically at a high level is going to be an expert in compliance and ethics. And not every monitor, as we know, the healthcare industry is incredibly complex. Hospitals have many different regulations they have to comply with, which are different than perhaps an health insurance company, which is different from a medical device company. But what the independent compliance monitor is going to have is expertise on compliance programs. Having said that, that independent monitor, for instance, if they come in and do a proactive assessment, may identify gaps in particular areas. Maybe they identify a gap in your HIPAA privacy and security program and controls. That monitor may actually have that expertise, or may actually be able to bring in someone with specific HIPAA security and privacy expertise to then help that company shore up that program, that HIPAA compliance program. Does that answer your question?
It does. Okay. And then I really wanted to, unfortunately, we're nearing the end of our time, but I wanted to conclude with asking you if you could give us some examples of different types of independent integrity monitoring in the healthcare space.
Yes, I'll kind of quickly. So, for instance, independent monitors can be used, and we've been brought in by a hospital, for instance, that was under investigation for potential Medicaid fraud involving situation where the people that were providing particular services weren't all licensed or being supervised the way they were required to be under the state Medicaid guidelines. It's a very important provider. The government doesn't want to lose good providers because access can be a big issue in government programs. By bringing in an independent monitor, this organization was able to help demonstrate to the government that the issues were not endemic, can be remediated, will be remediated, and that there's an independent expert a credible independent expert who will make sure that they comply with these remediation measures and regulations going forward. That actually, gives the government a certain comfort level. It also supplements their own resources. This way, the government doesn't have to continue to use resources to monitor the company while it continues to practice.
Well, Jesse, unfortunately, we are near the end of our time. I've been visiting with Jesse Kaplan, the Managing Director of Corporate Oversight at Affiliated Monitors. We've been introducing the use and value of an independent integrity monitor in the healthcare sector. Hopefully you'll join us again for our next episode where we take up proactive assessments of healthcare ethics and compliance programs and cultures. Jesse, thank you very much.
Thank you, Tom.
Hello, everyone. This is Tom Fox again. I'd like to thank you for listening to this episode of the special 5-part series on monitoring in healthcare. I hope you'll join us again tomorrow for another episode. This special 5-part series, sponsored by Affiliated Monitors, is a part of the Compliance Podcast Network.